Welcome to the Aspen Medical Podcast. My name is Eamon Quinn and I'm from the Aspen Medical Marketing and Communications team, and I'm your host today for the podcast that we're going to undertake with my colleague Paul Dugdale. Paul is the Senior Medical Advisor to our Global Advisory Services team. We're going to chat a little bit about, obviously, still a very live issue is COVID, and Paul is going to take us on a whistle-stop tour through a number of different issues around that. Paul himself is a specialist public health physician with experience as a policy advisor, a senior executive, and a primary care physician. Previous positions Paul has held include Director of GP Financing in the Commonwealth Health Department, Chief Health Officer of the ACT, and Executive Director of Medical Services for Canberra Health Services. His clinical practice is in chronic disease management with a special interest in obesity. He is Associate Professor of Public Health in the ANU Medical School, where he is Director of the Centre for Health Stewardship and has published on health policy, chronic disease, and health system design. Key roles would be in public health advisory in relation to solution development and requirements for government regulatory and exemption criteria. We're delighted to have a man of his stature here today with us, and as a colleague of ours in Aspen Medical Global Advisory Services. Paul, you're more than welcome.
G'day, Eamon.
Paul, we'll get straight into this because this is really interesting. We had a quick chat just before we began, so I know you're going to take us into some dark places, but the light will re-emerge. So let's have a quick recap of a question, which was the COVID pandemic has had a huge impact in Australia and around the world. How does this compare to other previous pandemics?
So pandemics have occurred throughout human history, and of course, well before that. People could say that in some senses the human race is a pandemic. I guess a lot of people think of pandemics starting with the Black Death in Europe in the 14th century. And rather than talking about the microbiology of it or the medical side of it, the social side of pandemics is really how they have their most lasting impact. With the Black Death probably being one of the causes of a shift from principalities where the different princedoms were feuding with each other towards city-states where they were actually more concerned with looking after their own citizens and laying the foundations for the Renaissance and the rise of democratic city-states. Smallpox, a couple of centuries later, was a fairly common disease in Europe, but when it was introduced into South America as an epidemic there, it really gave the conquistadors the upper hand and is perhaps the main reason why they conquered South America and wiped out the Mayan civilization and led to that kind of complete change in geopolitics. And then the Spanish flu in the 20th century after the First World War just killed so many people. There was a shortage of labour because that amount of death followed the war, and that shortage of labour left capital with not as many people as it needed to employ. So we got into capital speculation through the 1920s and the crash of 1929 as the capital speculation all came home to roost. So that's 10 years later, the Spanish flu was still reverberating through world history. What that means for the COVID pandemic, I'm not sure.
But okay, so just rewinding a little bit there, what you're saying is essentially is that all these pandemics have had major social impacts, things that went on to change democracy in one instance, the economy in another instance. Yeah, so we're looking at the same, even though we're in the early stages of this pandemic. I mean, yes, for many of us in lockdown and so on and so forth, 20 months is a long time, but in reality, it's probably not as long as many of these pandemics in history had gone on for, that we're still in the stage really where maybe the social impacts of this are just beginning to unfold and how our lives will change, whether it's the economy, whether it's how people work, flexibility in their working arrangements. So these things some people are saying that these are only transient, they're only something that's happening because of the pandemic. But what you're suggesting is these things are fundamental changes that are now going to take place.
Well, it's possible. So we've had 2 years of the COVID pandemic, and I guess the question is, where will things go from here? And there are definitely fortunes to be made and lost. Our knowledge is changing all the time with the pandemic. Our practices, our social practices have been profoundly changed. Mask wearing seen in a lot of countries that we would never have thought that it could catch on. The handshake is becoming filled with anxiety in a lot of places. And then, the products, office buildings laying empty for almost 2 years. So that's on the downside. But on the upside, being able to respond to COVID and development of the vaccines has created fortunes for those companies. It's ushered in the mRNA vaccines, the first ones we've ever seen using this new technological platform. And that will change how we do vaccines going forward from here. The companies that can respond to the supply chain disruption that we're seeing around the world at the moment, from shutdowns in manufacturing operations, difficulties with transport, and it's become a commonplace that, every problem we've got last year used to be, it's due to COVID. Now we say, it's due to the supply chain problems. The companies that are solving those supply chain problems are going to make a fortune. The companies that are waiting for goods to arrive that can't arrive are going to get into credit problems. So how these supply chain disruption will reverberate around the world, I don't know. But there's more of that sort of thing to come. The labour disruption, the unleashing of inflation in the US, and probably commencement of it in Australia. These are major changes. The one that I think's been most profound is the shift away from public live performance in the arts. And to me, that's one of the great tragedies of COVID. And getting public performance going again is such an important part, not just of Australian culture, but around the world. And that's been something that Aspen's been particularly working with the events community to try and get that back on track. Because a lot of public performers, there are the stars, but there's the whole journeyman side of it where they live on the smell of an oily rag. And being able to get public performance going again is a major task facing us in 2022. I could go on, but there's a lot of changes still to come, and it's going to be a different world.
Well, it's interesting because I just to go on the performing arts piece, one of the last things I remember doing prior to the lockdowns emerging, and that was in the latter part of February 2020, was I was at a concert in Melbourne. And even at that stage, the virus was beginning to emerge. And you had maybe 10 or 15,000 people in the, I think it was the Margaret Court Arena. I'm going to show my age here. I went to see Rick Astley and AHA, so those 1980s icons. And what I felt about a month after that was I thought my kids would never get to go to a concert. To me, that was a huge pathway into my teen years, was going to a concert on your own. And all I could think of was that my kids might never get to go and see a concert. And I was really sad about that. So you're absolutely right. I can't wait to get back to live, big public performances if that ever happens again in the way that we had grown up with over the past, 50, 60 years. So I think you're absolutely spot on with that. International travel is something that we talk a lot about in Australia because we seem to want to escape as soon as we possibly can or invite people in as soon as we possibly can. it's beginning to happen. In the last few days, Qantas have repositioned their A380s back into Australia. So things look like they're about to take off quite literally. How do you think that's going to play out, international travel?
Well, Australians are great travellers and Australia is a great destination. And I think there are few countries in the world that have felt the isolation of COVID as much as Australia has. It is getting going again, and in the last month, New South Wales, Victoria and the ACT have welcomed fully vaccinated international travellers into their cities and countryside without quarantine. There's been over 7,000 international arrivals into Melbourne and Sydney in the last few weeks, and they've been vaccinated and they have not been quarantined. And the epi curve, the daily new cases graphs have continued their trajectory, and it has not been affected in any substantial way by those arrivals. So we've seen in Sydney the continuing reduction of daily cases, even though we've opened up internationally. In Melbourne, the epi curve has followed the expected projection. It's now peaked and probably on the way down, and has been able to do that even in the face of the end of quarantine for international arrivals. So I think these first tentative steps to reopening international travel have been successful, and we'll see how they go. It is a different thing opening to communities that don't have any substantial community transmission, such as Queensland, West Australia. And so things need to be taken more cautiously there. But I think 2022 is looking like a very, very different year on the international travel front than 2021 has for Australians.
I hope so. I clearly wasn't born in Australia. I'm Irish by birth, and I have a couple of kids over there who are either looking forward to coming over and seeing me or me going in the opposite direction. So hopefully things open up in a way that makes people comfortable about international travel, because, again, it's a personal experience. I'm kind of saying, some long haul pilots haven't really done this in about 2 years. I know it's like riding a bike, but I'm kind of in the space where I personally want to see what happens over the next maybe year or 18 months to see how the pandemic evolves and how the virus evolves before I start jumping on and getting down to economy class and trying to sleep on an Airbus A380. Interesting stuff. Lockdown has been lifted in a variety of states and territories, so New South Wales and the ACT and Victoria, and people are beginning to return to the office. Paul, in your opinion, and I suppose in the opinion of Aspen Medical Global Advisory Services, is that a public health risk?
Well, look, it is a risk, but it's one that I think we can manage. And we've got 2 years of experience now in managing the pandemic. We've had 2 years of getting used to social and physical distancing, to hand sanitation, and also to working from home. So I think the return to the office is not going to be an all or nothing thing. It looks like working from home to some extent is here to stay, and getting back into the office, that will help decompress the offices and allow the personal interaction that you do get in an office situation that is very hard over Zoom or at home, and hopefully we can get the best of both worlds. Now, that's going to require some vigilance for people with respiratory tract symptoms to stay at home and test themselves or get tested for COVID. It's great to see the home test kits coming on the market. And I think the tolerance for your office co-worker coming into work with, it's just a bit of a cold or a sniffle. We haven't seen that for a couple of years, and that's a good thing. And I think that people can now feel, well, look, I've got a bit of a sniffle, but I can still work. Well, you can still work from home. So with a sensible approach to it, with testing for people when they are symptomatic, for maintaining a bit of physical distance, for mask wearing in cities where COVID is prevalent, it should be a safe approach to the return to office work. And I think that's what we're seeing in Sydney with that continuing decline in daily new cases, even though the CBD is starting to fill up again.
And did you expect that decline? Is that something that, was this always going to happen? I mean, it's a standard bell curve type thing, isn't it? These numbers were always going to go down. I mean, are we expecting, in your opinion, that we may see further waves, and it's been called now it's going to be called a pandemic of the unvaccinated. Do you see it that way?
Look, the way that a particular outbreak unfolds is partly predictable. It's partly amenable to various measures to reduce the peak, to reduce the effective reproduction number and reduce the transmission of the infection. But they do have their own natural history, and they do have that impact of good measures to reduce that impact. I think that's one of the things that we're really learning fast, is what works and what are unnecessary measures that just don't have much impact on it. It's going back to international travel. I think testing people before they get on the plane and trying to reduce transmission on the aircraft, and then retesting on arrival has been a good way of reducing transmission through international travel. Similarly, in the office and with the return to ordinary life in those cities, Canberra, Melbourne, Sydney, that have been affected by these recent waves, trusting that vaccination will work seems to be a good strategy, and it does seem to really be working perhaps more effectively than most of the models were showing. So that vaccination level is proving to be strongly protective, and one of the aces that we've got in this pandemic now.
You've kind of touched on it there a little bit in the last answer you just gave there, Paul, where you spoke about some lessons that have been learned. Can I just ask you as one final question, what have we learned about public health responses in Australia and indeed overseas, and what can we do better as this pandemic progresses?
I think the first point to make there is that we've learnt that vaccination works. It's our strongest strategy, and it may well be that while Australia was a little late getting everybody vaccinated, we will have one of the highest vaccination rates in the world, and that is going to be strongly protective. Something we learnt fairly early on was that our messaging is really important, and the messaging around social distancing was wrong. We should have been talking about physical distancing from the start, and social strengthening is needed, and we need to stay in touch with people, and we need to reach out in new ways if people are isolated at home. In the isolation and quarantine controls, we've learnt that mental health is as important as physical health, and that we need to pay attention to it. We need to watch for signs that people are decompensating if they're isolated, and we need to provide support to really help them in those situations. We're finding better ways to monitor the pandemic and local outbreaks, and we'll probably be moving more and more toward local suppression for local outbreaks and move to local control. And the large-scale national and international measures that have been taken in 2020 and 2021, I think will evolve toward much more local responses. And finally, I think we've learned that we've got to pay a lot of attention to the most vulnerable in our society, that's where the biggest impact of the COVID infection can be felt, and that's where our strongest efforts need to be made to protect the elderly, to get our Indigenous communities vaccinated, to reach out to people who are anxious about vaccination, to people who are isolated in the responses that we make from working to home to quarantine, and really think, how is COVID affecting the most vulnerable in our community? Because as with so much in our social lives, it's the way that we work with the most vulnerable that is the measure of our civilization.
With that in mind, Dr. Paul Dugdale, Senior Medical Advisor to the Aspen Medical Global Advisory Services team, thank you very much.